You're listening to Trust Talks, the podcast that brings you real stories and insights from people doing incredible work in our community and beyond. From everyday experts to extraordinary collaborators, whether you're here to learn, get inspired, share a laugh, or just enjoy some honest conversation, we're glad that you're tuning in. Hello and welcome to Trust Talks with Matt and Sarah.
In today's episode, we're talking about carers, who they are, what they do, and why their role is so important.
Whether it's supporting a loved one every day, helping someone manage their appointments and medication, or simply being there when it matters the most, caring comes in many forms, and as part of Carers Week, we're joined today by a brilliant lineup of guests to help us explore what it really means to be a carer. So let's meet our panel. Who have we got today? Do you want to introduce yourself?
Hi, I'm Jane. I am a part carer for people in my family, and I work as a care involvement facilitator.
Perfect.
Hello, my name is Costa Nichols. I am a carer. I've grown up being a carer. I'm also an occupational therapist by background and currently allied health professional lead for acute and crisis care.
Thank you very much. So, what does the word carer mean to you guys?
So I guess you've got different types of carers. So you have unpaid carers, and they might be family or friends that support loved ones from various ages in life. And then you've got paid carers, so people that work in care homes, people that go and visit people in their own homes. I guess. Well, got to think of a question again. I ramble quite a bit at times.
That's all right.
I think for me, a carer, I always now think of the unpaid carers, families and friends who support people who cannot cope without their support. And there are many, up to probably 10.6 million across the UK. And 78% of those are worrying about being able to care in the future because of the demands that the caring has on them. So I always think it's really important that we in society identify everybody that supports somebody due to a health condition, mental health, physical health, learning disability or an addiction, and that person cannot cope without their help. And that could be a young person as young as 4 or 5, all the way through to somebody who's caring for somebody maybe in their 90s, caring for their spouse. And people can have a sandwich carer, and that's a term for people who have multiple caring responsibilities. So it could be a parent, a partner, a young person. And it's really important that we identify them, and that's what Carers Week is all about, really making sure we identify those people and value their support that they provide, and we help and support them.
Because I suppose some people might not even see themselves as carers. They just assume that because they go around and help their mum one night, go and see them for an hour in an evening, and does that technically make them a carer? Like, what is there a definition for a carer?
The definition is somebody who provides help and support to somebody who cannot cope without their help. So if that hour a week is important to maintain that person's health and well-being, then they could be classed as a carer. We don't like that word. I mean, I'm a daughter, I'm a sister, I'm a sister-in-law, I'm a friend, I'm a mum.
Yeah, of
and
course.
That's how I identify. And it takes people about 2 years to identify as an unpaid carer. But it's important that we do, because they have some rights. They have that right to be listened to and to be consulted when somebody comes into a health service, for instance. They should let their GP know that they're a carer. They have a right to a carer's assessment through the local authority. So that's where they live, where they pay their council tax, helps people identify that. And many, many other rights as well.
I strongly agree with that, because the point you were saying, Matt, I didn't want to identify as a carer. So growing up, my mum had lots of various health issues, physical health issues, mental health issues, and history of complex trauma as well. And I remember growing up as a teenager, probably I don't know, maybe just before I was a teenager, actually, I started to really notice the implications or the effects some of my mum's health conditions were having on her. And she's a nurse by background. And she would say, Kosovo, you need to get support from the Young Carers Network. I was like, no, I'm not a carer. Like,
Yeah.
I don't associate with that term. And, you know, I was a young child / adult growing up, and I didn't have anything against carers. You know, it's like you were saying, it can take a couple of years to really accept that term. And it was real little steps for me. So I had a caseworker or case care worker who would come and spend time with me. Initially, she started doing the assessments in my family home, and I guess I was quite lucky where my mum had been a nurse and she worked in the community and the voluntary sector. She had some contacts and she was able to kind of get me to understand a bit more about the role that I was playing. But I didn't want to associate with being a young carer. They had lots of groups and events that they would do for the young carers, and I didn't attend any of them. I just didn't want to. I did attend one. I went to Nando's once, the local Nando's, and that was nice. But again, I think it's quite difficult because obviously as a young person growing up, you have your own identity that you're kind of developing.
There's that like social pressure as well, isn't there? To sort of,
pressure.
You don't want people to look at you in a different way sometimes.
Certain way, which sounds awful, doesn't it?
Yeah.
But you've always got this, you know, kind of running in the back of your mind. And I think like Jane was saying, and you as well, you don't necessarily see the things that you're doing as being a carer. Like I was just supporting my mum with various aspects of her life. So I didn't feel that I met, you know, I fell under that bracket. But I would regularly meet up with my case or care worker, and she was fantastic. You know, she really provided me with a lot of support, and right up into my 20s actually, because, so I'm trying to think of, Jane, you'll know, but the definitions of young carer, and then I think 18 to 25 you still have ongoing support. Young adult carer. Yeah. So I would have that support with her. And every time I'd go home, because my mum doesn't live where we are in Hampshire, she lives further away, but I would have that contact. I'd be able to contact this caseworker over email. She'd be able to telephone whenever my mum was in hospital or anything. I would have that regular contact, and then she would be able to kind of link me in with other organisations in that local area, where I could go and fight for support, because I will say it was a fight. It still is a fight, unfortunately. So
yeah, and I think particularly with young carers, there is support out there for them, but people have to refer or signpost the young people to them, and we all have a play, like schools, children's services, health, etc. And we had Young Carers Action Days always in March every year, and we had 2 young carers come to talk to our trust and the staff back in March, and they were very proud to care for their families. That really stood out. But they were being supported by their young carers group and getting a lot from that, but they also really want to champion young carers. So it's good to hear their story and their challenges, and they explained some challenges, and they just said, look, please talk to us in a way that we understand, and that you don't have to make it simple, particularly for their age group. They're about 13. Just tell us straight, so that we know how to help their parents who are under the mental health services, and we know how to help them when they're struggling. Just please tell me straight. And that was a good message to hear for staff. But of course, you've got to get that right for the ages.
I think also that with identifying as a carer, you kind of probably put your own needs potentially second, don't you?
Definitely.
And it might be a case that you might be caring for someone else, but at the same time you realise your own mental health and physical health might be deteriorating. So do you experience that at all? And if so, how do you manage your own well-being?
Yes, so I have experienced that. I guess so I grew up having cold sores. Cold sores were my sign of stress. So I'd break out in cold sores quite often. I remember one period of time when my mum was in hospital, and I actually started to lose my hair. So my hair was falling out, and that was obviously in response to the stress. I'm an only child. I grew up as an only child on my mum's side. I've got a younger brother, but much younger on my dad's side. So it was always me and my mum growing up. So I kind of have that sense of responsibility and wanting to care and wanting to look after people and feeling like I have to do it all. And that is a trait of mine that I'm really trying to unlearn, because it's really, it's not a nice place to be in. And I'm, up until in my third decade now, and I'm really trying to unlearn some of those, it's not a skill, some of those attributes.
It's probably, you feel like it's part duty, part responsibility, part,
Yes.
and that you don't want anyone else. Potentially there might be an element of not wanting anyone else to do that care.
I think there is,
because
that
you
as
know
well.
your mum best.
Yeah.
And maybe there's a trust issue, I don't know, with
100%.
allowing other people to come in and care.
And I think being let down by a lot of services in the past, I think that's something. So, like, I'm an occupational therapist by background, I always want to do the best for my patients. And I've had previous managers tell to me, Kosovo, like, take a break, you know, someone else can do this. But I think that comes back to it as well. I always want to be the person to do right by others and support people. And I find it really baffles me when I don't see the same treatment, you know, either by colleagues, but as a carer, seeing the care or lack of care that my mum has been given in the past. But I guess, going back to how it impacts me, it 100% impacts me. It impacts my relationship with friends and family. Physically, it affects me. Mentally, it affects me. I'm a strong advocate for counselling, and that's something that I found very beneficial, and just to have that space by myself to discuss all of the things that I have going on, because, you know, I think something that I really struggle with as well is my how other people view my mum, because they're fully aware of the carer burden that can come with being a carer from my perspective, and they're very protective over me, but then I'm also very protective over my mum. So if I hear people saying, oh gosh, you know, Kosovo, you have it so hard, I'm like, yeah, but she's got it harder. So sort of thing. So but counselling I find really important. Exercise, to just going out for walks, trying to be open and honest, but I will shut down quite a bit. I'm quite I can be quite stubborn. And if I don't want to talk to people about how I'm feeling, or I go quite inwards, because I'm like, well, none of you can help anyway, so what's the point in speaking to any of you? Hence why I like to go to a counsellor, because I know that I can just speak to that person. They're not going to hold on to anything I'm saying, but even that can be quite difficult. And I know that as a therapist anyway. But I like to speak to someone external.
Yeah, I think every carer I've spoken to, and I've been in the NHS for 26 years and listened to lots of stories in the various jobs that I have, is we always feel guilty, don't we?
Oh, yeah.
I think every time guilty, not doing enough, not noticing enough, just having a break, just thinking, give me time out. And I think I actually said that this year when my mum has got some chronic health conditions, and she was in a lot of pain, and I could feel the stress, but my stress was coming out as I was angry. And I think we can identify with that, and I think it was just having people to go to for me, because there's lots of looked after people in our family, but I just blurted everything out on a message to my closest friends, who just came back and just checked if I was okay. And that's all I needed, that safe place to just go. And somebody responded, and I was fine. And also in where we work, we have a Staff Carers Together network, and we do that virtual hug and support and caring for each other as well, which I think is really important. If people can have that in their workplace, it really does support staff.
Yeah, it makes a huge difference.
And it's probably providing that non-judgmental safe space, isn't it, for you to be honest about potentially a burden on you as being a carer, although you don't want to use the word burden, but if you strictly define that, it would be, wouldn't it? And it's about, I guess, as carers, you need to look after yourselves, but is there any advice you would give to families and friends who are seeing you being a carer and saying, oh my gosh, this is just too much for them? How can we support them to support the ones that they love? Because they're probably going to feel that need. You know, friends might come to you, as you say, Jane and Kosovo, they might come to you and say, gosh, you're doing too much. How can they support you?
I think just saying that, isn't it? Because we say, don't we, if somebody has that space, and that safe space to just go, let it out their feelings
Yeah.
without any judgment or bias, and knowing that people will be that empathetic, compassionate, probably have a bit of understanding because they may also have caring responsibilities, and they allow you to do that, and they validate those feelings, and they then say, what can I do? Just get me a cup of tea or G&T, depending on the time of day, or just provide that listening ear. Like we all say, if the society, if we had better listening ears across our society and saw people and recognised them for what they do, it would help.
Yeah, no, I strongly agree with that. I think it is just that listening ear, like you say, without judgment, without the suggestions as well. And I know people are trying to help, but oh God, we've been through it all. So, why doesn't mum just get a carer? We've been down that road 100 times. We've tried various care agencies. We've done, direct payments. We've done a lot. We're in it. We've been in it for years. And I get people are trying to help, or they, try and suggest this one thing or this one. And there might be occasions where, oh yeah, we haven't tried that, but unfortunately, we've been through a lot, and we're ongoing. We continue going through a lot. So yeah, just having that space to talk without judgment, and to be able to speak openly yourselves, is really helpful.
It's that offloading, isn't it?
Yeah.
That's, you don't need someone to, as you said, give their input to it.
Yeah.
You just need someone to offload
Yeah.
to.
Yeah, because they can't fix it, and we know
Can't
that.
fix it.
And a lot of the people that we care for, unfortunately, the diagnoses that they're living with, unfortunately, they will be getting worse for a lot of people. And we recognise that. So yeah, we get that you can't fix it. We wish that we could fix it, but just that listening ear.
And I think it's just remembering that unpaid carers, they don't get paid, they don't have holiday pay, they don't have sick pay, and they're caring for somebody without any training. So what can we do to help and support them? People can have a carers assessment through their local authority. It's their right, but that's kind of means tested with regard to the carers allowance. There is carers groups across the UK, and I can talk, and carers support or charity partners. So I can talk about Hampshire. So in Hampshire, in Southampton, we've got Unpaid Carer Support Southampton, the Portsmouth Carer Centre, Isle of Wight Carers, and then there's the Princess Royal Trust for Carers and Carers Together. Now in other counties, they will have those support as well. And the best place to look for the UK is probably look at Carers UK and Carers Trust, and they'll be able to signpost you to people who can help and support you, and see what's on offer. Because it's really important to help people in unpaid carers role.
Are there any kind of like misconceptions when it comes to carers? Like people have like a misconception about what a carer might do, or
I was going to go down the route of the assumptions of being a carer as well. Perhaps, maybe not a misconception, but an assumption potentially by health professionals that you will take that caring role. Certainly, I mean, just from my experience, my mother-in-law had to have a hip operation. She's 83, lives at home on her own. Her husband died a good 20 years ago. She wants to remain at home. There was a massive assumption that someone in the family would step up and look after her for those 2 or 3, 4, 5 weeks that she needs. So I guess from my point of view, you feel duty, and it was an awful thing because I had pleasure in looking after her in a weird way, and I got to know her a lot more. But that was a burden, or took time away from my family and my workplace, so that I was able to do that. And it was a pleasure and a privilege to do that. But there was an assumption when you went to that hospital appointment that basically there's no one else to look after her during that recuperation period.
that is what you're going to be doing.
Her daughter-in-law. You're her only daughter-in-law.
Yeah.
You need to step up. You need to do that. And actually, it's quite frightening when you're looking after someone who's just had major surgery, and in the middle of the night they're screaming out because you can't work out where the pain is, and it's a bit of a trial and error, and you're not sure what you're doing, whether that's right. And I guess there's a little bit of knowledge there about, am I doing the right thing? Am I making things worse? Have I given her too many drugs today because she's in pain? And keeping a really good note on your actions to her. But there is a big assumption that you will take on that mantra, whether you're a family member or a neighbour. And I guess that's a good thing to discuss, is around the role of a community, isn't it? You know, where does the caring responsibilities lie? There is this kind of unsaid rule that as a family, you will pick it up. And sometimes you're not in a position to pick that up, but then that's probably where the guilt potentially comes in, you know, around, oh my God, I can't do that for my mum anymore.
And you have the right to say, it's the carer's right to provide the care or not. And if you can't, then you have to say, which is hard to say. But and also caring responsibilities change. So if somebody comes into hospital and then they're discharged, what they did before they might not be able to do, or things might have changed they might not be able to do. So we can't make that assumptions. We've got to have those open, honest discussions and hear the lived experience of the person providing the care.
No, I agree with all of that. And I guess I was going back to what you were saying about the assumptions. So, for example, I live about 60, 70 miles from my mum now. We're still very close. We speak multiple times a day, and I speak to healthcare professionals multiple times a week, if not more frequently. But yeah, I'll often get a look when they say, oh, I'm going back to Southampton. They're like, oh, you don't live here? And it's that disapproving look. It's like, well, no, I don't, but I do an awful lot. Thank you very much. And yeah, feeling like that guilt associated with it. And I think it's really difficult because I feel quite lucky that I have still been able to do a lot and live my life. And, you know, I've got my own family now, I've got children and all of this. And I think that's amazing. But I think for me personally, a lot of people don't see behind the Instagram post or the Facebook post, shall we say. They don't see everything that happens behind closed doors and all the things that I have done. And I think growing up for me, I really struggled with that kind of identity. As we were saying before, I'd have friends that say, well, why can't you come out? Or when I was going back home, I said, well, why can't you come and see me? You're only here for a weekend. I was like, yeah, because I'm spending that weekend and helping my mum, and there's things that we need to do. And I think I always found that battle really difficult. And back to kind of the bias, I think, again, similarly, growing up, I didn't want to be a young carer because I was like, well, a young carer is this sort of person, and that's not me. And, you know, it was really hard to accept that. So I think, we were saying about bias and different perceptions. I definitely had my own perception of what a carer looked, or specifically what a young carer looked like. You'd look at, you know, things like children in need, and you'd be like, oh God, like, so now is, you know, do I fit into that? Well, I know I did, but seeing it is really difficult, and understanding it and hearing it. So that can be hard.
Yeah.
I think you must go on a kind of a journey, really, as a carer, don't you? Because there's that initial, oh gosh, I've got to look after this person, to then thinking, am I, as I said earlier about, am I able to look after them? Am I able to do the best thing for them? Am I the right person to be caring for them? And I guess I'm just thinking about one of my friends, her mother-in-law is developing Alzheimer's and dementia, and she's witnessing somebody that's used to be a very strong character, very in control of her life, deteriorate. Now, she's trying to do her very best for that person but juggling her own life-work balance. And I guess one of the misconceptions potentially about carers is that you potentially have to give up everything else in your life to become that full-time carer. And I guess these days there is a little bit more support out there, isn't there? And there isn't, people don't always have to give up their other lives and their work lives particularly to become that carer.
They have the right to their own life.
Yeah, exactly.
But you find that it does come second, which you said earlier. And my brother-in-law's got dementia, and I've supported at least 3 very close friends whose parents had dementia, and that has a real impact on people, as you say. But the other one one of the ones that sticks out to me is when somebody's husband or partner or wife or son or daughter suddenly becomes mentally unwell for the very first time, and the first experience of mental health is when they're sectioned under a Section 2, and that kind of said they just took their loved one away and I didn't know what was happening, and you can just imagine there goes that trauma again, doesn't it? How that must feel for that person. It is just terrifying. So we have to help and support them. And in our trust, we are members of the Triangular Care Framework with the Carers Trust, which is a quality improvement tool to make sure we identify and work with those people that support people in our care. So it's all about identifying carers, training staff, not letting consent and sharing information be a barrier, because we've all come across that one, haven't we? Having carers champions in each team, a care introduction to the service, and a range of care support services available. So making sure our staff know that, to share that, but really that we listen to carers, identify them, work with them, and they become that crucial partner in care along with the service user and the staff.
And that triangle literally is a symbol, isn't it? Where you've got the professionals at one top of it, you've got the patient themselves, and then you've got the carers. So, and they're all equal parts in that relationship, hopefully. Why do you think that can sometimes be the case with healthcare professionals? We hear it a lot. Oh, they don't listen to the carers, or they're kind of, dare I say, a little bit patronising with them, or a little bit dismissive of their views. Why do you think as healthcare professionals behave like that?
Well, I think it's that, you know, sense of, well, I know best, we know best. I've been to uni, I've studied this, I know exactly what I'm talking about. You know, my mum's got lots of different health conditions. She's a black woman. So how her skin might show up against a white person's skin is not the same. When she's got an infection, when she's got awful swelling, and, you know, the A&E consultant is saying, well, this is exactly what it is. It's like, but we have an experience of this. Please listen to us. Please review the discharge letter, or the, you know, from the lymphedema clinic, from this, from that. And people just don't listen, because I do honestly think it's a sense of, we know best. We've seen this tons of times before, but it's like, but you've not seen it in this person, or with someone from this ethnic background, or, you know, and I think that's, personally, I feel that's what it comes down to. People thinking, we've studied for this, I know exactly what I'm talking about.
And maybe it's a confidence thing, that they know best and they don't want to be
challenged.
Perhaps asking questions like, what do you think, might look like they're not being professional enough, or in our view, but actually that's what we most want, isn't it? To be able to say, how is your mum today? Have you seen any changes in her lately that we need to be aware of, rather than saying, right, we'll just do a blood pressure instant now and we'll get a picture right now. It's talking to you, as you say. I mean, we've spoken about before that carers are 24/7, a lot of them, and healthcare professionals only may see them for 30 minutes or an hour, or when they're in full crisis, so they don't know the picture of the build-up of how they've got to that stage.
But I mean, we all know the triggers and the signs. We know that person. The person that we go and see in a hospital, for instance, or any health professional, may only be seeing them for half an hour every few weeks, but we know them. So we know the signs of when they possibly are deteriorating, or when they're in pain. We also know what we do to help bring them round or help and support them. That is crucial information that's needed for care planning. That's crucial information that people need to hear and listen to and respond to, and help the patient.
I guess you could use the word, you're almost the patient's advocate, aren't you?
Definitely.
You know what their wishes are in that respect.
My mum says that often. She'll often be like, thank you so much for advocating for me.
We definitely emphasise that in our training, everything we do in our carers work. And I'm definitely the advocate for my mum. And I am probably a tougher person when I've got my carers hat on for my family than I would be in my professional. Although I represent carers all the time, but with as much as I can do, with that empathy and compassion. But put the hat on me outside, and you probably see a side of me you don't see at work.
I agree.
Do you think? That's so interesting you said that, Jane. Because do you think carers have that kind of persona, like nosy and interfering and coming across as, oh right, what are you doing to my mum now? I need to know, because that's like a misconception potentially, isn't it? Mark,
potentially.
Matt?
I mean, I'd say I'm the daughter that you don't want to have to come across. So I don't care when it comes to my mum's health. And if I think you're being disrespectful and you're just ignoring and you're not listening, then I will say something. And especially because when you're in these situations, you're exhausted. You know, you've been on this whole rigmarole with your loved one. They've probably been suffering for, you know, a few days to a week to a month before this has got to crisis point. And then for someone to turn around and not listen to you. And I guess what I was saying about being the advocate for your loved one, on the flip side, I've also experienced it when things haven't gone to plan, or where I potentially haven't used my voice as much, then you get that in the back as well. So sometimes, yes, my mum will often say, oh, you've been such an advocate for me, but then there will be times like, why didn't you tell them this? Why didn't you say this? Or because she can't do it. She's in so much pain. She's exasperated, whatever's going on for her. So it's a really fine line, isn't it? Because I don't want to do all of the talking for my mum, but I also know that there's times that she does need me to convey or get across, but then it can be such a battle if, like we said, the healthcare professionals have got their pen and agenda and they're not listening to what you're saying anyway. So you always feel like you're in this kind of catch-22, don't you?
Yeah. My mum refers to me as the bossy daughter to every health professional, GP, A&E, consultants, whoever it might be. And I said, I'm a bossy daughter because I love you.
Yeah.
So when I stop being bossy, you know,
Yeah.
jokingly. But I think for people who are able to speak up, it's good. But I'm more concerned about the people who feel they're not seen or heard and they're judged and they probably are being quieter. And it's those people we need to help as well and really bring forward.
So what advice would you give to somebody who's probably just potentially starting out their journey as a carer and faced with quite a lot of healthcare professionals and feeling that perhaps they need to speak up? How do you start those conversations?
I think when you start caring for somebody, you will start to hear the word carer. Now, as we said, people don't like it, but that's the generic term to describe a hero group of people, because quite frankly, anybody who provides unpaid care is a hero, and society should recognise that. And get, but straight away ask what help and support's available wherever they're going to get the care from for their loved one or their family or friend member. Find out what carer support is available, because there's advocacy services. So the carers organisations that are out there do provide advocacy services as well if you feel you can't speak. Try not to let the white coat syndrome take effect of you. I think that's not the right word. And just, you know that person best, and just say, please hear me. Can I have a voice in their care? Because we still hear people say, you know, we can't talk to you because we don't have consent. Well, you don't need consent to listen to somebody, and actually it's a human thing to do. Listening to somebody helps you find out about a person and lets you know how that person is. I was talking to somebody earlier who said that the team that was providing care to the person that they support also then said, I'm contacting your GP with your consent because I'm a bit worried about you. So that's recognising the well-being of the care as well. So I thought that was really good to hear that today. It was earlier today. So yeah, a shout.
I suppose talking to your employer as well as the carer, because you know you could, there's like flexible working options, you know, laying it on the table early on and just saying, like, you know, this is the situation.
I do think that's quite helpful. I've been really fortunate to have amazing managers throughout my career. I've been very fortunate, and they maybe not as at the beginning, as in I wasn't as open about mum's various health needs, but it became very apparent, and there were times I would have to literally leave. I remember I was working on acute mental health, or I've worked in the community physical health, and I'd have to just leave and say, I'm really sorry, I've got to go. It happened 2 weeks ago. My mum was taken into hospital, and I emailed and I called. I was like, I'm so sorry, but I really have to go. Mum has been taken into hospital. It's urgent. And that makes such a difference. And things like the Carer Support Network, which Jane is instrumental in, thank God we have that. And I think I joined probably about 2 years ago now, maybe. And I was just so upset that I didn't know about it before. And any members of staff that I support or I line manage that have carer responsibilities of any kind, I signpost everyone now. I'm like, you don't have to go, but it's just something for you to be aware of, because like we said before, there might be periods of time where your caring responsibilities are quite low, everything's ticking along okay, but during those times of crisis when you really need that support, or even just during when things are going okay, I think it's so important to have that transparency. But like I said, I don't think I was completely, I don't think I was hiding anything, but I wasn't, you know, shouting about my mum having all these different health issues initially. So I think that can be quite hard as well to have that discussion. You've got to have someone that you actually trust. someone that you know will support you. Because if you haven't got that, why would you speak to your manager or colleagues or whoever it might be?
Yeah, and it's a carer's right to request flexible working. Also, last year, the Carers Leave Act came in. So anybody who's working has a right to 5 unpaid carers days leave a year to help them in their caring role, and look out because things might change for that in the future as well.
Jane Kozua, thank you so much.